Hello, welcome to Doctor Talks. This is your host Vivek. Here we chat with best doctors about diseases and conditions they treat. Our guest today is Dr. Ashutosh Ajri. Dr. Ashutosh is a specialized orthopedic surgeon in shoulder, knee, and sports injuries. He is among the best shoulder, knee, and joint replacement surgeons in Pune who specializes in arthroscopy surgeries, replacement surgeries, and sports ligament injuries. Welcome, Dr. Ashutosh.
Hello Vivek, thank you for inviting me to Doctor Talks.
To start with, I would request you to share your background in medicine with us.
Hello, I am Dr. Ashutosh Ajri. I am a shoulder, knee, and sports injury specialist specialized in arthroscopy, joint replacement surgeries. After completing my MBBS in 2005 from BJ Medical College, Pune, I joined deployment in orthopedics at Sancheti Institute of Orthopedics and Rehabilitation, Pune, where I was awarded University Gold Medal. Then I further did my DNB Orthopedics in 2010 from Dinath Mangeshkar Hospital, Pune. During my diploma in DNB orthopedics training, I developed an interest in sports medicine, especially in shoulder and knee injuries. To refine my skills, I got enrolled in various international fellowships. To start, I joined Arca Sports Clinic in Germany in 2013, and then as a foreign medical scientist at a shoulder department, Samsung Medical Center, Seoul, South Korea in 2016. In between, I joined Department of Shoulder and Sports Injuries at Dinath Mangeshkar Hospital, Pune, as a full-timer lecturer for 2.5 years. Last year, I was invited as visiting fellow at Perth, Australia, to share and learn some complex shoulder surgeries. I am a founder of Ardha Orthopedics and Physiotherapy Care, a center for sports injuries. I am also a unit head of shoulder department, Sancheti Hospital, Pune, and I'm a visiting surgeon at Columbia Hospital and Dinath Mangeshkar Hospital, Pune. I had conducted various cadaver workshops to treat arthroscopic and joint replacement surgeons. My special area of interest are arthroscopy surgeries around shoulder and knee injuries. These are arthroscopic surgeries of shoulder dislocations and cuff tears, shoulder replacement surgeries like reverse shoulder replacements, sports injuries related injuries around shoulder and knees, geriatric shoulder problems, and also like to train sportsmen to avoid injuries and perform better.
Thank you, Doctor. Today, I wanted to discuss about sports injuries with you. Can you please share sports injuries that you treat?
The most common joint involved in sports injuries are knee, shoulder, ankle, and even sudden onset back pain. Most of the patients come with ligament and muscle injuries around these joints, especially in sportsmen who are involved in sports like football, running, mostly come with symptoms related to knee, ankle, and sometimes back problems. And sportsmen who are involved in overhead sport activities like cricket, volleyball, boxing, badminton come with symptoms related to shoulder, elbow, and core weakness.
What are common preventive steps that sports players or anybody playing sports can take?
Good question. Sometimes preventing common sports injuries is beyond our control, but many times sports injuries can be preventable. Every workout should start with gentle warm up and stretching exercises to prevent common sports injuries. Getting warm up increase the blood supply to the muscles and get your more flexibility and decrease the chances of injury. You should always respect your body. When your body is in pain and fatigue, you should stop immediately. You should always use good sports related protective gears just to prevent the injuries. You should gradually increase the intensity and duration of the training. You should undertake fitness program to develop strength, balance, coordination, and flexibility. And most common thing is you should allow adequate time to recover between the workouts and training sessions. You should practice in safe sporting environment, and you should also concentrate on good nutrition.
I have heard about P.R.I.C.E protocol in case of sports injuries. Can you please elaborate on it?
The P.R.I.C.E protocol is effective for most sports related injuries. It is the most common protocol followed as a first aid and sometimes as treatment as well. P.R.I.C.E stands for protection, rest, ice application, compression, and elevation. After the injury, you should always protect affected part with a splint, pad, or crutches. Then the joint should be given rest to restrict activity that aggravates your injury. Apply a lot of ice packs immediately, which will reduce pain and swelling. It reduces the requirement of painkillers. Apply ice packs several times a day for at least 15 minutes. Apply compression like braces, caps, compression bandages as a support to prevent additional swelling and blood loss. You should elevate the limb above your heart level to reduce swelling. You can also supplement with non-steroidal anti-inflammatory drugs, which will help in reducing pain and swelling and early recovery.
Let's now discuss about few specific injuries. Can you share more about two common knee injuries which I have heard about? One is ACL tear knee injury and other is meniscus tear knee injury.
The knee is a very complex joint in human body. Your knee is formed by four bones: thigh bone, two leg bones, and kneecap. These bones are connected to each other by ligaments. These ligaments will act like a strong rope to hold the bone together and keep your knee stable. There are four primary ligaments in the knee joint. These are two cruciates and two collateral ligaments, and two cushions we call it as a meniscus. The collateral ligaments are found on either side of your knee. They control your side to side stability to your knee joint. Cruciate ligaments, as your name suggests, they form a cruciate at the center of the joint. They cross each other in the form of X. Front ligaments is called anterior cruciate ligament and back ligament is called posterior cruciate ligament. They both give front and back stability. Meniscus are two wedge-shaped pieces of cartilage which act as shock absorber between your thigh bone and shin bone. They are tough, rubbery to help cushioning the joint and keep it stable. ACL and associated meniscal injury is one of the common knee injuries. And ACL and meniscal injuries often happens during the sports and fitness activities. That involves sudden stop, change in direction, jumping and landing. But in India, other main cause of ACL injury is road traffic accidents. At the time of injury, patient will feel a loud popping sound and a sensation in the knee joint. Association with a severe pain, swelling and collection of fluid in the joint, so that athletes will not be able to continue playing and even walking. Later, when pain and swelling reduces, he will have a feeling of instability or giving way sensation while walking, stair climbing and running. Associated meniscal injury may be presented with locking of knee. There will be a combination of symptoms which can be presented in my OPD.
How do you treat these knee injuries? If you can cover both medicine and surgical interventions required for complex cases?
When an athlete visits my consulting room, I need to discuss in detail about history of injury and symptoms. After that, I will examine knee and check all the structures of injured knee and compare with normal knee. Most ligament injuries can be diagnosed with thorough physical examination of the knee. I will further investigate it in the form of X-rays. X-rays will not show any soft tissue injuries, but it will help to rule out associated damage to bones. The gold standard is MRI, that is magnetic resonance imaging. It will give a better imaging of soft tissues like anterior cruciate ligament. It will help in grading the ACL tear that will help in decide the further line of treatment. MRI will also help in identifying associated other soft tissue injuries which can be managed accordingly. ACL can be graded in 3 grades. Grade 1 is ligament where it is mildly damaged and stretched. All the fibers of this ligament are intact. So the treatment is P.R.I.C.E for few days, then gradual mobilization and aggressive physiotherapy so that patient return to the pre-injury level. In grade 2, the ligament is further damaged and stretched. It is often referred to as a partial tear of ligament. If overall stability of knee is intact, you may be recommended non-surgical treatment as grade 1 tear. In grade 3 sprain, is also called complete tear of ligament, where it will be torn in two pieces. This type of sprain is more commonly called as complete tear of ligament. Due to this, the knee joint is unstable and complete tear ligament do not heal on its own. To restore knee stability, the ligament must be reconstructed using tissue grafts. These grafts act as a scaffold for knee ligament to heal. The regrowth of the ligament takes time. It may take 6 months or more before the athlete can return to sports after surgery. For meniscus, treatment will depend on type of tear you have, its size and location. Incomplete tear can be managed with conservative treatment in the form of P.R.I.C.E initially and then aggressive physiotherapy later. But the complete tear needs surgical intervention. The peripheral tear, where the blood supply is good, we can attempt to repair. But the central tear, where the blood supply is very poor, we may have to excise the torn affected part of the meniscus. These all surgeries can be done with minimally invasive arthroscopic surgery with very small incision. The benefit of lesser invasive techniques include minimal pain, minimal scar, minimal blood loss, reduced hospital stay, early mobilization, quick recovery time.
After the surgery and treatment for a severe cases of ACL and meniscus tear, do players recover fully to their previous performance, or certain challenges stay with them in terms of their capability and flexibility to move?
Most of the athletes return to the pre-injury performances, but the physiotherapy plays an important role in recovery. It may take them 6 months or even more before the athlete can return to sports after surgery. We need to be very particular about the surgery, the time for healing, and post surgery rehabilitation. These are the three important factors which contribute to the athlete to return to the pre injury level. It has to be very meticulous about all these aspects.
Let's now discuss about a common shoulder injury, which is dislocation of the shoulder. Can you elaborate and explain it to us about this injury?
Yes, the shoulder is most mobile joint in the body, which has compromised its stability for mobility, more susceptible to dislocation. As this joint is a ball and socket joint, ball is formed by the upper end of the arm bone and cup is formed by the socket, which is a part of shoulder blade. Ball is 3 times bigger than the socket, so there is a large discrepancy in shape, size, and strength. But to increase the depth of the socket, there is a special ligament configuration around the socket. We call it as a Labro capsule complex. This will increase the depth and stability of the joint. Shoulder joint can dislocate forward, backward, downward, may be complete or incomplete. The most common is forward dislocation. When shoulder dislocate, the ligaments in the front of the shoulder are often injured and we call it as a Bankart tear. A shoulder dislocation may be caused due to sports injuries. The most common is the contact sports, cricket, football, hockey, sports like gymnastics and volleyball. Other main cause is motor vehicle accidents and fall from height, ladder or just tripping. In small minority of patients, the shoulder can become unstable without any history of injury. In such patients, the shoulder may feel loose or dislocate in multiple directions. We call it as multidirectional instability. These patients have naturally loose ligament throughout the body.
How do you treat a shoulder dislocation?
Whenever there is an acute dislocation of the shoulder, you should get medical help right away. But while you are waiting for medical attention, don't move your joint and the shoulder should be splinted or sling should be applied in the current position. You should apply a lot of ice packs so that the pain and swelling will subside. But after suitable assessment and x-rays, shoulder can be reduced with gentle reduction methods. You may need to use muscle relaxants or sedations or rarely general anesthesia before manipulation of your shoulder joint. After reduction, we will be asked to use sling for 2-3 weeks to keep a shoulder from moving. Male in the teens, 20s, a group that tends to be physically active, are at high risk for shoulder dislocation. So the prevention is better than cure. And to help prevent shoulder dislocation, you should take care to not to fall, not to get injured. You should always wear protective gears while playing contact sports. And you should exercise regularly to maintain strength, flexibility in your joint and muscles. Once you are dislocated in your shoulder joint, you may be more susceptible to further shoulder dislocations. To avoid recurrences, you must follow a specific strength and stability exercises with the help of sports consultants. You may need surgery if you have a recurrent shoulder dislocation despite proper strengthening and rehabilitation. It's an arthroscopy keyhole surgery to repair and recreate the torn ligament of the shoulder. It's a minimal invasive surgery and patient recovers very fast. Some patients may need an open surgical procedure if you have damaged bony socket due to recurrent dislocations.
Now let's focus somewhat more towards the rehabilitation after a patient suffers from these kinds of sports injuries, which could be either a knee injury or a shoulder injury. So if you can share, doctor, about that, what is the rehabilitation? How do you counsel your patients and guide and help them during this phase of the rehabilitation? Because I believe that's also a very critical phase after the treatment, right?
Yes, rehabilitation is very important during the healing stage of ligaments. Rehabilitation protocol for athletes are customized as per their injury and sports. During this phase, you will be put in functional brace. Then the isometric exercises are started as per the site of injury. Target area during rehabilitation will be put to full range of movement to maintain the tone and strength of the joints. Then later, the strength program are started to protect the healing ligament. The final phase of rehabilitation is aimed at the functional return, which are tailored as per specific sports.
How is the rehabilitation program planned for the injuries we discussed, namely ACL tear in knee, meniscus tear in knee, and shoulder dislocation?
Yes, physical therapy is very important for recovery. The first focus will be on range of movements of the joints and surrounding muscles. This is followed by strength program designed to protect the reconstructed or repaired ligament. This strengthening gradually increases the stress across the ligament, and the final phase of rehabilitation is aimed at the functional return, which are tailored for specific sports. It may take him 6 to 12 months for athletes to return to the sports.
So, doctor, can you cover how do you do the tailoring of the recovery or the rehab program depending upon the kind of injury?
In an athlete who had a knee injury and has been operated on knee, you have to basically work on the multiple aspects. The first and most important thing is the core. The second is the thigh and hamstring muscles, and third is the calf muscles. Not only the strengthening, the rebalancing of the muscles is very important. We basically focused on more on core strengthening exercises first and gradual stretching, strengthening exercises. During the immediate post-op rehabilitation, we focus more on closed chain TheraBand based exercises where there is a gradual stretching, rebalancing of the muscles, and the further we put him on a gym based protocol where there is a immediate strengthening of the muscles, and later we put him on the sports specific therapy where there is a rebalancing of the muscles and gradual put the stresses on the ligaments where it can regenerate and remodel according to the forces in the body. In a shoulder injury, when it's especially in the shoulder dislocations where there's a loss of balance between the muscles and there is a loss of stability in the shoulder, for that we have to work again core, periscapular muscles, the muscles around the shoulder, and the posture of the shoulder. If you miss the link any of this, then there is a chances that the injury may recur and chances of redislocations are very high. So we have to work on periscapular muscles, core, and strength around the shoulder joint. This can be done with a supervised TheraBand based protocol where there is a closed chain exercises where there is a rebalancing of the muscles and gradual tensioning of the muscles.
So, doctor, we have covered about the common knee injuries and shoulder dislocation. We also talked about a P.R.I.C.E protocol and how it is very important to initially provide first aid to the sports player who gets injured. Can you recall any specific patient case and share about it with our listeners?
Yes, I can recall a badminton player. She had an injury to her right knee during the game. She had sudden give away a pop-up sensation and swelling in her right knee. She was not able to continue the game. When I examined her, her knee was filled with fluid and there was swelling and her movement were very painful. I gave her brace, few medicines, and few basic knee exercises. I asked her to continue ice packs and rest. In few days, her MRI was done of right knee, which shows a complete ACL tear and complex inner meniscus tear. I explained her that she need a surgery in the form of ACL reconstruction and inner meniscus repair. As she was a professional badminton player, she was put on pre-rehab prior to the surgery. The pre-rehab will increase the surgical outcome, shorten hospital stay. She will regain strength fast and give her time for mental preparation for surgery. After a few weeks, her arthroscopic ACL reconstruction was done using graft and also was able to repair her inner meniscus. After 6 weeks of rest, basic exercises, she was put on ACL rehabilitation protocol exercises. She started hitting gym and sports specific training after 3 months of surgery. After 4 months of training, she was back on court. It's been 2 years. Now she is playing. I can also recall a second player. He is a Ranji cricketer who had a fall during a practice session and had dislocated his right shoulder. He is a right arm spinner. His shoulder was reduced locally and later he continues to have apprehension and subluxation while throwing and bowling. I examined him and found his shoulder very unstable. His shoulder was further investigated with X-rays, MRIs, which showed a Bankart tear with a small bony defects in socket and ball. I explained him that he need a arthroscopic keyhole surgery to repair the torn ligament. He was also put on pre-rehab before the surgery. After surgery, he was started on sling, few basic shoulder exercises, and after 6 weeks of healing, he was started with TheraBand-based rehabilitation protocol. He started hitting gym after 4 months of surgery and sport-specific training after few days. He started practicing in nets after 8 months of surgery and now he's back with his team representing his state team. I'm very happy with this outcome.
Great, and that's nice to hear. Once you treat such a sports player, do you continue to track their performance?
I follow them after 6 weeks, 3 months, 6 months, and 1 year. And I follow every year. I ask them to come and visit me every year, and reassess them every year. If I feel they're lacking somewhere and need to be corrected, I make sure that they do a good rehab and go back to play.
Oh, that's nice of you. Dr. Ashutosh, your inputs today helped us understand sports injuries and their management better. Thank you for talking to us.
Thank you, Vivek. It was a pleasure to be part of Dr. Talks. Bye-bye.
Dear listeners, please share and spread awareness about sports injuries, their prevention, first aid, and treatment by sharing this podcast of ours with Dr. Ashutosh. Cheers till we meet next time.